My name is Chandon, and this is Tracy.
Hello.
And we are with Isthmus Wellness. And today we are going to review the Celluma red light device. So I personally feel like in the world of red light devices, there's so many options. Now, when we got into red light, like 10 years ago, maybe, there were really only
I think it was in 2020, actually.
Well, but before we ordered them, but when we were doing the facial. But
yeah.
Anyways, it's been some time, and there were only like 2 or 3 devices to really choose from at the time. And so, we found a device and we just stuck with it. And I feel like there's all these knockoffs and some aren't as powerful as the others. And so we're going to give you a review of the Celluma and why we like it and its features and just how we tend to use it. Let's start with like how and what we use it for. So what do you tend to use it mostly for?
I mostly use it in conjunction with facials.
Facial?
Yeah, when we do a facial rejuvenation acupuncture session.
Okay.
So once all the needles are in place, this can be propped up over the face, like in the picture.
Like she has it going this way, or you can just wrap it right over the face.
Yep. And so it runs for 30 minutes while they're resting with their needles in.
Awesome. Yep. So you do mostly facial?
Mostly facial. I have used it for other things as well, like pain.
Okay.
And some other odds and ends. Yeah.
I guess I use it a lot for facial rejuvenation, especially when people come for acupuncture and facial rejuvenation. I feel like if we're going to like put the body into healing mode and rejuvenate, yes, coming to me once a week will help, but what are you doing on a daily basis? And renting the Celluma is a great thing to kind of propel people forward into actually working on some of those fine lines and tone, that type of thing in the face.
Yeah.
Another reason I personally use it, and it's still emerging in research for the most part, but I'll use it for egg quality or fertility, just blood flow, things like that. I feel like we know for sure it doesn't hurt, and how often are people like sunbathing and getting light that low on their belly? Not very often. And so I really like it for actually applying it on the abdomen. I use it a lot too for like just inflammation in general. So for pain, I'll actually, and I just want to show it because I feel like sometimes people get in their head and make it more complicated than they need to. But this is the device itself. And as you can see, it bends. So you can bend it over the face. But for me, when I do my spine, just as a general anti-inflammatory, I'll take it like this and I'll just thread it down the back of my shirt. And obviously you don't want to lean like your full weight, but I'll just sit up kind of with a little bit of support and like read my book or whatever. And I'll run it either in the pain setting or the anti-aging setting. If I'm in pain, then I'll choose pain. If I'm really just trying to focus on inflammation and blood flow, I'll do anti-aging. There's also an acne setting. I'll use the acne setting for acne.
Yeah.
But it's also really good for wound healing. So a few times, when my clients have had like roughed up or fallen, just bruises and open scabs and scrapes and stuff like that. If they have a red light at home, I'll recommend them do it on the acne setting as well. Cool. So those are kind of some of the reasons I use it. I guess we do a lot of knees in my house. So the cool thing, you can definitely put your legs together and do both knees, or you can do a single knee, especially this is the professional. They have a bunch of different series. This is the Pro. The Celluma Pro. So it's a little bit bigger, as you can see, versus some of their other models. But I think the biggest thing with red light is, and this is what I ask for my patients to do, is like just rent it from us and see if you can actually work it into your week, because doing red light is more about consistency than just, I did it once. Like you really need to do it like 16, 20 times, like within a month. And then you need to do it couple times a week for maintenance. It's not like a one and done thing. And I think that's a perception sometimes too that people have for facial, but sometimes also for pain. It's not just you do it once and you can tell. Now some people can, but I would say the majority of people, you're going to need to do it more to really see a benefit. I think another mistake people make is putting body lotion on their face or body lotion, face lotion or body lotion, and then go to put your red light on. And so the lotion acts as a barrier. So you're not going to actually absorb as much red light when you have oils and moisturizers on. So that's another thing. Like I'm not perfect about it. A lot of times if I'm doing my back or my stomach, I'm doing it at the end of the day. But if I'm going to do my face, I'll like wash my face or exfoliate my face and then do it and then put my moisturizer on just so there's no barriers. I think that's another thing. And honestly, maybe it's not for everyone, but I feel like this is one of my favorite home care, routines of sorts. Like this is I'm very compliant with it. I keep it by my bedside. I think part of the issue too can be people get it and they put it away in their closet. And if you put it away in your closet, it's out of sight, out of mind. So I do keep it. It's a little cluttery, but I've got a red light by my bed. It's just part of the routine. How do you use it or how do you work it in?
Well, actually, I will share that before we got the Celluma, before we decided to go with this device, we had tried out a different one. I don't know if you remember this. And parts of there were many reasons why we decided to go with Celluma. And one of the reasons is that like this other one was kind of cloth based, so we wouldn't be able to clean it very well between patients. Like this one is like a foam outer part, which is very easily cleanable. And it's easy to tote around. When it's kind of like rigid like that, it's not like too soft. But the other things is that this device was way more powerful than the other device. And so like for context, I am really sensitive to the light of Celluma. Like if I put it over my face, it's hard for me. So like I need to wear goggles and I actually need to wear like 2 pairs of goggles.
Really?
Yes, it's too.
I don't work.
I know you don't.
I'm supposed to, but
you're a unicorn though. So, but the device that we tried, I can literally put it over my face and open my eyes and it's totally fine. So like the brightness is way drastically different. Like this is way more powerful.
And I know I keep referring that as a red light device, but I know the wrinkle study and the pain study and the acne study, and they're all a mix of different spectrums. Can you comment on that a little bit?
Yeah. And I mean, it makes sense to call it red light because that's like what people know in the ethers. But technically the Celluma is a combination of 3 lights.
Okay.
So it's red, blue, and infrared.
Okay.
And then the device that we have here, the Pro, is pre-programmed with a certain proportion of those 3 different lights in each of the 3 programs that it offers. So, the pain one is going to be stronger. It's going to have more of the one light versus the other 2. The acne is going to have more of the other light versus the other 2. And then the wrinkles setting is... So it's made into those pre-programs to address those concerns, right? Because the different wavelengths of those color of lights are going to penetrate to different depths through your skin. So it's done very purposefully. Basically.
Okay. Is the pain one the one that penetrates the deepest?
Yes.
Okay.
Yes.
Great.
This is true. Yeah. So the pain penetrates the deepest.
Okay. And then I know that says pulse on it.
Yeah.
What do you know kind of like when you would turn the pulse on or off on the device?
Yeah. Generally, the default is to leave the pulse on because the pulsing does have a stronger effect.
Okay.
Yeah. So the reason you wouldn't use the pulse is if someone was like sensitive to flashing lights and that sort of thing. But most of the time you're going to leave the pulse on.
Okay.
Yeah.
And is there anyone that you don't think should do the red light?
Oh,
There's a big list, isn't there?
I think there is a big list. I don't have it off the top of my head.
I mean, I know for sure, if you're very, very headache prone, epileptic, but I would definitely check a contraindication list online if you're concerned.
I mean, they would probably say pregnancy and if you're on cancer treatments.
Yeah, of course. There's one time where I turn the pulse off.
Yeah.
So sometimes, especially in the winter when I'm working on my laptop, I will turn the red light on diffusely in the background to help with the blue light I'm being exposed to on my screen. So and I'll get ready in front of it as well. And I don't like the pulse on, obviously.
Yeah.
So I'll almost use it as like a diffuse light in my room if I'm getting ready. In the winter, you're getting ready, it's pitch black. I really love getting ready with that light on. And then also working with it kind of in the background. So I just thought I'd share my tips.
Yeah, I love that. I love that. Yeah, I guess there's one other thing we should mention is that we also have another device that we carry.
What's that other device from Celluma?
So the other one is called the Pro Plus. And instead of 3 pre-programmed settings, it has 4. And so the 4th one is known as the contour setting. And so that has red, blue, infrared, and then they want to say like near infrared, far infrared, whichever one this one doesn't have. And so that one is meant to help with body sculpting and contouring. And so it is meant to, again, be used regularly in order for it to work. And we recommend 3 weeks minimum. But it is, people say that it can reduce inches.
Wow.
I know.
So we're just put it on my belly or whatever.
The places where you want the inches.
Okay.
So it look different.
Can you do, if I rent the contour, can I do, let's say I want to do my belly and my thighs, can I do both on the same day?
Yeah.
Okay.
Yeah.
But I can't do my belly twice.
I don't know.
Same day.
I mean, usually there is a dose to how much your body can uptake that signal from a red light therapy. So most manufacturers recommend every day or every other day, even some of them, for certain conditions and things. So yeah, I think that's probably not necessary. Yeah, just do the one time.
Okay.
Move along and do somewhere else if you need.
Okay.
Yeah.
Awesome. Thanks.
Yeah. A couple other, I have a fun case study about somebody using the Celluma to help with kind of an off-label issue, which was they had a breast cyst. And they'd had it checked out by regular Western medicine routes and everything. And they were like, oh, just take some ibuprofen. It's inflammatory. It'll go away. But she asked my advice and we did red light over it. And she rented the device for a few weeks, did it about 4 times one week, 3 times the next week. And definitely by the 2nd week, it was reducing. And by the 3rd week, it was gone.
Wow.
Yeah.
On a breast cyst?
On a breast cyst.
So did she have fibrocystic breasts or just
a little bit?
Okay.
Yeah, a little bit more in that vein. And but this one was, had grown and was a little painful. Yeah. Anyway, so this helps that a ton. So kind of a fun off-label use. But then otherwise, I use it with pain from time to time, and we'll have people rent it for a week or 2 when they're having a really acute sciatic issue or something like that. Yeah. I think it works really well.
I think one thing that people sometimes are confused about is the time of day to do it. I've kind of looked into it, and I feel being mindful of the circadian rhythm, it is probably really good to do first thing, just with the natural light and the sunrise coming up. However, I try to do most of my red light while the sun is still up. So in the summer, that doesn't really affect me. But in the winter, I have to kind of rework it, but I'll still do it, honestly, when it's dark. And I feel like I sleep better. And I had one client who, him and his wife ended up getting one or whatever after they rented from us. But they got it more for pain issues. But he said, if I do it, I sleep well.
Oh, that's awesome.
It's definitely big on circadian.
Does it matter where he does it to have that?
It doesn't matter.
No.
It doesn't seem to matter for me either. I think it's because the red light helps counteract all of the blue light that we're exposed to unnaturally high levels. And so it just seems to have a good effect on circadian rhythm and sleep. But
cool.
Yeah.
Yeah. And I guess in some way, our skin does have photoreceptors, right? So
yes.
Yeah. So doing it at night, your body will think there's daylight around.
Yeah.
Yeah. Very cool.
Yeah. So that's kind of how we use it. If you want to try it, you can rent it from us. We rent it through the clinic. You can sign it out and you can keep it as many weeks as you want or just do it for 1 week. But I think the most important thing about getting started is just making sure that you actually are going to work it into your routine before you go and invest in a device like a Celluma or another red light. That's all I have for you.
Thank you.
Thanks.